My whole life I've been athletic. I was in sports and everything. So the injury for me was unknown. It could have been anywhere because I'm always in contact and this kind of thing on a daily basis with the sports activity. So I don't know directly when it happened up to this point. But there was an instant where I thought I was getting what's called a red eye. So I went to the pharmacy, I got an eye drop, and within a week, I think I knew improvement. So one morning I went to work and I saw a white spot in the eye. So I asked my supervisors to leave and go to the eye clinic to check it up. Doctor said I had an infection in the eye, and from there is where the treatment started.
That was Shameer Nazeer, a firefighter of 9 years and a qualified electrician by trade. What he was diagnosed with is known as a corneal infection. Earlier this year, on May 3rd, he was able to benefit from one of the first corneal transplants done at the Georgetown Public Hospital Corporation since 2019. Ophthalmologist at the GPHC, Dr. Celeste Hines, who has worked with Nazeer, explained that there are a number of ways that the cornea can become infected. These include fungal or bacterial infections that infiltrate the eye, trauma to the eye, such as scratches, or a disease known as keratoconus, which causes the cornea to gradually bulge outward into a cone shape.
Cornea is a transparent structure on the front of the eye. Most people don't know it's there because it's so transparent you don't see it. You usually see the iris, the brown part, but in front of that brown part, well, in brown or blue or green or whatever color your iris is, in front of that there is a clear curved structure. It looks kind of like a contact lens, right? But it's a natural part of your eye. It's usually transparent. As long as it's healthy, it's transparent. So the main problem with the cornea is if it gets cloudy, it's not functional. You can't see through it, all right? Because it's a clear lens and you need it to be clear to see through. So if there's an opacity to the cornea, there's no way to get rid of opacities. Once they've set in, it's scar tissue. You can't get rid of it without removing it. And if you're to remove that scar tissue, you will actually damage the integrity of the eye, you'll damage the structure. So corneal transplants are a way to remove that defective, that cloudy tissue and replace it with clear tissue. Now the only tissue that the cornea can actually respond to is more corneal tissue. So how do we get that corneal tissue? We actually have to have it donated by another person. Usually a person is dead. So organ donations in other countries include corneal donations. So patients, when they would have died, they would have probably donated kidneys, livers, lungs, whatnot. They can also donate their corneas. So those corneas are removed and preserved, processed. No diseases, nothing. Everything is processed and cleaned and shipped within a certain period of time because, of course, you can't retain the tissue for too long. So it's shipped. We get the corneas. We determine the size that the patient needs. We would stitch that new cornea, probably just a circular part of it, on a circular hole that we would remove the opacity from the patient and stitch that cornea back on.
Imagining tiny stitches being applied to the very delicate organ that is the eye might be off-putting, and indeed, Dr. Hines noted that it may result in some discomfort for patients after their surgeries are completed. Still, the firefighter said that the discomfort pales in comparison to being able to see again.
It was painful, but it was worth it, because now I could wake up in the morning and see. It might not be as perfect as it was, but it's a slow process. And I'm getting improvements every time. Every day, gradually, I'm getting improvements, and I'm very much grateful for that.
Currently, these corneal transplants are made possible through the support of the George Subraj Foundation based in New York. This non-governmental organization works on procuring corneas and then shipping them to Guyana where transplants can be done. Head of the Department of Ophthalmology at the GPHC, Dr. Shailendra Sugrim, however, noted that the forthcoming organ transplant legislation will reduce the need of having this body part shipped to Guyana. Reporting for the newsroom, I am Vishani Raghabir.